This is a pattern I discovered 20 years ago. It's called oblique downslip. It's a variation of traditional downslip. Now, Jennifer presented with a traditional pattern of downslip, and she had blocked superior mobility pushing through the left sit bone. Now today she has good mobility there, so she no longer has that downslip. And you can find other videos on downslip where you see the technique that I use to treat it. I want to focus on this being a unique and rare pattern of oblique downslip. And I had this pattern due to a motorcycle wreck and went undiagnosed for a very long time because no one knows about oblique downslips. And finally, when I figured it out myself, I treated it and achieved significant benefit. It even stabilized the pubic joint. What I'm suggesting is that the hemipelvis has slid down just very slightly in an oblique direction, 45-degree angle from the sacrum. And so that will make that PSIS lower, which is somewhat subtle, but it will also make it deeper because it falls off the slope of the sacrum and it's distinctly deeper. That would certainly tense all of the soft tissues here, including SI ligaments and iliolumbar ligaments, the muscles, and sacrotuberous ligament as well. And if we come down here and I palpate sacrotuberous ligament and I try and spring it, it feels very hard. It's supposed to have a little bit of yield. On the left side I can indent it slightly. So this is tight, and we tested a while ago and came into that little triangle in the area of the above the sacrum, in the area where the iliolumbar ligament is, in addition to soft tissues such as the multifidi, erector spinae. And if I try and indent that, that's rather firm, and if I come on the right side and I try and indent it, my thumb is distinctly deeper on the right. So we have increased tension in the soft tissues here. And what I'm going to do, my goal is to take this hemipelvis and gently roll it up in an oblique direction. And so I use the leg as a lever because, of course, the top of the femur is inserted into the lower part of the pelvis. I have two pillows under her stomach, and I'm putting my hand above the waist so that I can feel and make sure I don't torque in the lumbar spine. That's not what I want. So I want to take the hip. The hip is in abduction, just comfortably taking it outward, and then slowly, comfortably taking it upward. And so I'm trying to roll this hemipelvis up in an oblique direction. And I will do that, and I hold it just so gently up where there's a natural stop. And I keep steady pressure there, and I've noticed in the past that it'll go small increments. The other thing I'm going to do after 2 minutes is I'm going to use my belly and I'm going to push into the thigh so that I also get a gliding movement. So after 2 minutes of holding the leg up obliquely, I'm also going to push into it and create an oblique glide. Okay? So I'm not going to film 5 minutes of me treating her, but that's the treatment. And the self-treatment involves getting the body in flexion. I have a home office. She traveled from Florida, so you can see her luggage there. It involves bending over and holding on to a piece of furniture, a stable piece of furniture with the right hand, and then bending the left knee and taking the leg outward into abduction, just comfortably so, and then rotating it back to a natural stop point. Make sure you stay in flexion, and I'm basically taking my foot towards the back of my right shoulder. And then I also do a lift to induce a glide, and I maintain that for 5 minutes. Now maybe not everyone has the endurance to do that standing on one leg. So 2 minutes would be fine, even 1 minute would be fine, and you could repeat it a few times. My belief is that this would be a one-time treatment, a one-time correction, but nonetheless I always teach everybody a home program. And because she's flying back home today, she needs to know how to be able to self-treat it if it should recur. And so if her husband helps her with the treatment, we film that way as well. And for me, it was a profound difference in my quality of life when I treated my oblique downslip. And I'll stop filming here. Thank you.